All right, and Dr. Widmeyer is here to talk about Widmeyer Optimal Wellness and optimizing your health. This is the year 2025, and we'll talk about that in just a minute. But you thought you had power outage, but now it's back on, so that's good news.
We did, yes, thankfully.
Good job. AEP is saying it's going to be Thursday, 6 p.m. before everyone has the lights back on, but we're hoping, like in Dr. Widmeyer's case, it's a lot sooner than that for folks. 8:30, we'll talk to Dr. Widmeyer. Wow, the results when we come back. It's 8:36 on the Morning Line on this Tuesday. It's the 7th of January, and we welcome back to the program Dr. Jeff Widmeyer, Widmeyer Optimal Wellness. Wow, it's great to see you. Do you like that?
Happy New Year.
Wow, Happy New Year, yeah. So I'm going to play real fast the Timothy. Can I play the Timote? It won't take away from your time.
Chalamet.
Yeah. And then we can all say it together because it reminded us, Brian, you were a trendsetter with, no, not a trend center, a trendsetter with Timothée Chalamet. Because that's what you've always called him that.
I have called him that for a long time.
And now Nikki Glazer, who hosted the Golden Globes, is in on it as well.
Sounds like something Adam Sandler would say. You know, Chalamet. Timothée Chalamet. Oh, yes, Timothée Chalamet. I think Sandler's here. Sandler, can I get a Chalamet?
Chalamet!
Oh, Chalamet! A good Chalamet to you, sir! A Chalamet to you!
Dr. Jeff Widmeyer, you watched the Golden Globes. You thought she was pretty good, Nikki Glazer.
I saw bits of it, yeah.
Yeah. And we were talking
You played some of the monologue in a break yesterday. I thought it was pretty good.
She's funny. She's one of those roast comedians, and she is not for the faint of heart, though, as far as
she
gets pretty vulgar pretty fast.
She'll cut deep if you're not careful.
So let's talk about, the results. Let's talk about Widmeyer Optimal Wellness and also optimization. That's kind of the word of 2025.
This could be your optimal year, perhaps.
Yes.
So I think, as I've said before, you can, through sheer willpower, and here it is, New Year's, and you've made your resolution, you've steeled your spine, and what if it's dry January? I'm going to go on a diet. I'm going to be one of those people that crowds everybody out of the gym,
right.
For the first 2 weeks in January.
You're going to go to bed at 9 o'clock every night.
Hey, that's pretty normal.
And those are wonderful things. If you can make those changes and stick to them, that's great. And all of those are very important to contributing to our health. The one thing that the hormone optimization does is it fills in a piece and it lays a foundation that you can't, through sheer willpower, change. As we age, certain hormones in our bodies start to decline, and if we can safely replace those for you, we can make all of those other efforts more successful. And that's been a trend I've been seeing over the last year and a half with our hormone patients, is people coming in and they're starting our ideal protein program to start to lose weight. And then they say, well, what's this about the hormones? And we have a conversation, we talk about that, and we get their blood work back, and I'm able to explain to them in a way. People who know me have said, and I think it's true, and I think I inherited this from my dad. My dad's a physician as well. And my dad always had the ability to explain complex medical things in ways that people who had no medical experience could understand. And I think I really inherited that. And so I find out who I'm talking to. It's a different conversation when I've got somebody who is, a farmer versus a nuclear engineer, just because their way they hear things is going to be different. One's not better. It's just different. Mm-hmm. And I feel like I'm able to read that and really explain to people in a way that they can understand. And so when we figure out that, in addition to, I want to start this diet, but we optimize their hormones, they come back and they're just like, I can't believe how much better this is going, how much better I feel. And so the combination of our weight loss program and just all the counseling that goes in with all that, I think can really be beneficial.
And we've been talking to you for a while about hormone replacement therapy, but you've kind of, after a conference not too long ago where one of the presenters was calling it hormone optimization therapy, which
Right.
also gives the great acronym HOT.
Hot, yes, which kind of has a lot of levels because a lot of the menopausal women are like hot. Oh, you better believe it. Or I feel quote hot again because Anyway, so yeah, it's a cute little abbreviation, but it does speak to what we really do try to do, which is make things to optimize as many things as we can so that our wellness and health is enhanced. Because rather than waiting for the disease to occur and then, trying to catch up and treat the disease, what can we do to make you as healthy and well and vibrant as possible in a safe way so that succeeding, the going forward decades of your life are just more vibrant and less marked by decline.
Yeah. And so it's those things that you mentioned at the beginning about eating healthier and losing weight and getting a good night's sleep and exercising. All those things are great in themselves.
They're critical.
But when you have the hormone optimization therapy, it can help enhance those. It helps
it
makes
lays the
those
foundation
better and easier.
So all of that is more successful. And the problem that so many people find, and I hear this echoed all the time with our patients, is I'm trying. Nothing I seem to do, I just feel run down. I don't feel like going to the gym. My brain's foggy. I don't feel like I have the energy. I go to the gym. I don't see any results. I'm still flabby. I can't build any muscle. And we find out, oh, yeah, your hormones are either subnormal or so far at the lower end of normal that, of course, you feel terrible. And when we bring those back up to a more normal level, it is truly life-changing for so many people.
What are the ages that we're talking about here that this is really ideal for folks?
Well, it's interesting. I have men in as low as their 30s who they say something's not right, and we check, and sure enough, their testosterone is really low, and so we can augment that. I have a few postpartum women who will say, something's just not right, and we check, and usually for them, it's low testosterone. And I've had several postpartum women that we give them sort of a boost of testosterone, and it only took one time for a couple of them, and it just like, okay, that reset things. So that's sort of the younger end of the spectrum. Obviously, men and women in their 40s, 50s, and 60s, that's sort of the peak of the graph of who is feeling it and who is interested. Women, as they get into the mid to late 40s, are reaching the perimenopausal range. By the way, my wife found this page on Facebook, this couple that does these funny little skits, and he goes, perimenopause, here comes perimenopause. So it was this little Christmas
is it the Holderness family? Yes.
It's so funny. Anyway, but he
perimenopausal,
totally
you went to school with her, right?
On all of the little points of perimenopause, and they hit on in that song that, oh, your doctor says, oh, you're fine. Here, take an antidepressant, and I have so many women who come in, they get their hormones tuned up, and they're like, oh yeah, I don't need these antidepressants, anti-anxiety medicines, because that's not what was wrong with me. What was wrong with me is my hormones were in the basement, and nobody was willing to listen to me. And I listen to you, and I draw your blood. Now, it's not I have this wonderful hammer, but it doesn't mean everyone's a nail. And so we have that discussion, and there's some people where I'll say, I don't think it's not time for you right now. But I think it's a discussion that literally every physician should have with their patient, and every patient should have the knowledge of what is my hormone status and what can I do to fix that and make it better.
And you've mentioned that before, that a lot of women would just be prescribed antidepressants for these symptoms that they're having, and it has nothing to do with it.
Well, it can temper the symptoms, but it's not treating the cause. And part of the rationale for that goes back to about 25 years ago now, when the Women's Health Initiative came out, which was a study that made big headlines and said hormone replacement therapy causes breast cancer. And the reality is, yeah, they saw it, but in the treatment group versus the control group, there were a couple of more cases of breast cancer. It was not statistically significant. They were studying oral conjugated estrogens and synthetic progesterone. What I'm talking about is bioidentical. I'm talking about giving you back the exact molecule that your body made, bringing it back up to the levels that you enjoyed, often for many decades, and it's a safe way to do it. But again, there are a lot of healthcare professionals out there who are operating under the idea that, oh, no, I'm sorry, estrogen causes cancer, and it's wrong. Or, oh, testosterone causes heart attacks and strokes, or it causes prostate cancer. Both of those are wrong. And I go into great detail, show the evidence for why this is a very safe thing to do. And it's not that it's just a safe thing to do. It is a very beneficial thing to do.
And it involves, well, go through the process of what it involves.
Well, so if someone comes in and we take a history and I find out what their symptoms are, and if it's appropriate, we draw some blood and we get the blood work back, and then we sit down and we go over the blood work. And if it's appropriate, the method that I like to use is what's called pellet replacement therapy, where there are these compressed, looks like kind of like a long Tic Tac or a long skinny Tic Tac, of this bioidentical hormone. It's plant derived. I don't know who figured out that some yam plant that grows out west actually has the exact molecule in it that we needed. I mean, you'd have to eat buckets of yams, I think, to get the effect. but anyway, so it's plant derived, bioidentical. It's not some bioengineered, big pharma thing. And we numb up a little spot on the hip, make a little nick in the skin, and I slip this thing under the skin, and it provides a nice, steady, consistent release of these hormones, again, that your body has enjoyed for decades, over about a 3-month period. And it is truly life-changing. And those are literally the words my patients say, is this has been life-changing.
If you have a question for Dr. Widmeyer, he's here in the studio, 846-8255. Shalom. That can be your greeting word from now on. If you have a question for him, though, 846-8255 about this procedure, do people feel the effects right away?
It varies. I have had people say literally the next day they can feel the difference. I've had some people where it's a little slower climb, and it may be a couple of weeks before they feel it.
And then is it, you're determining, though, how much, that kind of thing? Yep.
We base that on their initial levels, their age, weight, various other factors. And then we're following either follow-up levels or symptoms to determine if we need to tweak the dose up or down. I usually start fairly conservatively. That's a concern that some people have, is they think, oh, I'm going to feel too much of something or whatever. And I'm generally tend to be very conservative with my dosing and work up. And as my patients find out, they're not just, coming in and somebody sneaks up and jabs a pellet into them every 3 months. I mean, we sit down and have a conversation to find out exactly how they're doing. And my patients all have the number to call me anytime with questions and concerns.
And it's not very non-invasive.
Yeah, it's a little tiny, not even an eighth of an inch little nick in the skin. The only activity restrictions afterwards is I don't want people doing, deep knee bends and squats for a few days.
Brian, you're out of luck.
What are you going to do?
I tell you what, we have waited all show to have this woman from San Francisco talking about being healthy and why. What does she say? What's her question about? You don't have to be healthy.
She says you don't owe it to anyone.
Right.
What?
You don't owe it to anyone to be healthy.
Sure. How about to yourself?
Don't people, when you feel better when you're healthier, right?
Look, is that the lady who's
she's the weight stigma
czar
for San Francisco.
Talking about. Yeah, she's the person you really want to go to for your health information. I mean,
she seems to know a lot about cake.
Several different board certifications in obesity medicine and regenerative medicine. No, you don't want that. You want that lady.
We should.
So, all right, I'll just leave.
No.
Just
shame on us. We wanted to get we wanted to get your opinion on her, and we know we're going to get it. No, but you bring up a really good point that you've been doing this for more than 2 decades now, as far as guiding people on their wellness journey because you have the credentials.
Yeah.
You're just not somebody who kind of opened up a shop and said, okay, here, I'm going to do this.
Take a weekend course and start doing stuff. Yeah. And so when you get me, you're getting the doctor who is trained. You're gonna get me every time. You're not gonna get an assistant or anything like that. You get me, and when you have a question, you call my office, and guess what? Doctor calls you back, and we address whatever your concerns are.
Dr. Jeff Widmeyer, Widmeyer Optimal Wellness. Let this year be the year that you optimize your health. You'll say, wow, the results.
Yes.
And that's your website. All right.
WowTheResults.com.
Stick around one more segment, okay? Because we gotta laugh at this lady from San Francisco. We'll be right back.
You take it very seriously.
8:56 on the morning line. Mary Anthony Bryan all here with you. Dr. Jeff Widmeyer with us as well. And we're about to play you a little clip here of this woman. She is the weight stigma czar for San Francisco, and her name is Virgie Tovar. And as you can imagine with that job, she is not the slimmest of people. No great shock. Here's a little bit of her talking about problems with cake. I'm not making this up.
There's swinging tunes, some adult beverages, and
This is being at an office party,
Right.
and what goes on there. So that's what she's describing here.
good convo. And then it comes time to cut the cake, and someone decides to ruin everything.
Oh my God, that slice is huge. That slice is bigger than Beyonce's paycheck. Can you cut me half of that?
A cake-related fatphobic incident, or
That's right, a cake-related fatphobic incident, CRFI. It has its own acronym now, thanks to her.
She goes on to talk about how you don't have to be healthy. There's no law that you have to be healthy. But Dr. Jeff Widmeyer, most people they want to be healthy and want to know what they're eating,
If you don't want to be healthy, that's your right. But I think a lot of the folks like that, and all of their talk about body positivity and all that, I think that's probably masking some discomfort with, and they know that they're not healthy. And I think most of those folks probably in their heart of hearts wish they were healthier. And it can be hard. It can be very difficult to make a change. There's no question. Making a change is difficult, and sometimes it's even painful. I mean, any of us who have not gone to the gym for a while, and you come back, oh my gosh, I'm weaker than I thought I was, and I'm sorer than I thought I would be. But I heard somebody say one time, it took you a long time to get this sick. It's going to take you a little while to get well, and that's true. And I've even had some of my hormone patients who, they say, well, maybe it's not quite as big of an effect as I thought. I was like, dude, this is not Popeye in the can of spinach. It's not going to be like that. And I've had to remind people about that, it took you a while to get this quote unquote sick. Not that you have a disease, but you get the analogy I'm making. And it's going to take a little while to get better. But remember the old P90X tapes?
Yeah.
Those were 90 days.
Yeah.
And that's what, and if you stick to something really significant where you really are changing your eating habits, you are changing your activity habits, give yourself 90 days. And if you stick with it, you're going to see those results. And so, yeah.
Dr. Jeff Widmeyer, Wow the Results. That's the website, WowTheResults.com. Talk about hormone optimization therapy. Your consultations are free.
Yep.
To let people, kind of consult with people and let them know if they decide if they want to move forward with it. And we'll be talking to you again very soon.
All right. Thank you.